The health department admits errors and inconsistencies raised by experts from the University of the Philippines on the COVID-19 data. But Secretary Francisco Duque explained these are less than 1% of the data and does not affect the overall interpretation and are corrected right away. The CEO of Thinking Machines, the company that assists the agency in contact tracing, says the errors are mostly honest mistakes and there's no such thing as a 100% correct data set. The health department is also working with the World Health Organization for a new system that will automate data collection. To help us better understand COVID-19 data, we now talk to Peter Caiton. He's an associate professor of the UP School of Statistics and a member of the UP COVID-19 pandemic response team. Good morning, Professor. How serious do you think are the discrepancies and errors that you saw on the data?
Good morning, Ria. With regards to some of the errors there, we pointed them out because we were looking to help DOH and decision makers who are basing on the data to uh, make better decisions and to aid them in terms of the use of the data to these decision makers. Poor data quality leads to poor data analytics. And the UP COVID-19 pandemic response team has been always extending a helping hand to DOH, to their data, to their statistics, and therefore the insights that could be derived from the data.
All right, Professor, in their defense, the DOH is saying, well, it's only 1% of all the data, so it won't seriously affect what they're reporting. Do you agree with that?
Now, with regards to that 1%, it really depends because at the national level, it not might make much difference. But in terms of localities, that 1% might be those that affect them greatly.
I see. Well, you've identified a lot of the issues with the data, but moving forward, what should the government do in order to address these issues?
Well, what we've been suggesting to DOH is we have been always extending help in hand with DOH, and we've been thinking that DOH should also be starting to invest in terms of not just with the testing infrastructure in the healthcare sector, but also to invest with respect to the data handling and monitoring. It's a good news that DOH and their private partners are already doing that, as I've seen that, as I've heard a lot of the hiring of data managers and whatnot.
All right, so it seems they are open to your feedback as well. Is that correct?
They are very much open, and it's really that relevant to having this idea of open science that we could be able to hear different comments and different opinions coming from different scientists and researchers as well.
Well, Professor, you're the one tracking the data every day. What is your analysis? What patterns do you see as far as COVID-19 in the Philippines is concerned?
Well, what we see with the national story is that it's still in the inconclusive territory right now with regards to how the new cases have come in recently. We don't inconclusive in terms of whether there's declining or increasing transmission in the country. The local stories would be different. As I remember, Metro Manila is also in that inconclusive territory as well.
All right, so we do need more information.
In this sense, we would need more information, and we could have that more information if we do, for example, much more testing. I believe the DOH goal for testing is around 8,000, though I've heard more recent higher goals than that. But if we could at least reach about maybe 9,000 per day or more, that would make us able to better know the prevalence of COVID-19 in the country.
All right, thank you so much for your time this morning, Professor Peter Caiton of the UP School of Statistics.